Imagine stepping into like a high-end aesthetic clinic. You sit down with a doctor, and they offer you this totally wild proposition.
Right, something that honestly sounds completely made up.
Exactly. Like, what if a 30-minute, totally non-surgical procedure using literally nothing but a few vials of your own blood could just completely revitalize your sex life?
Yeah.
More specifically, what if it could make your orgasms, significantly stronger, more frequent, and just exponentially easier to achieve?
I mean, it definitely borders on science fiction. Or, depending on your level of baseline cynicism, it sounds like an incredibly lucrative $1,000 marketing pitch.
Right. Designed to just prey on insecurity.
Exactly.
It has that undeniable, too good to be true ring to it.
Right.
But we are looking at a diagnostic and clinical landscape right now that is shifting so rapidly.
Oh, absolutely.
Because female sexual dysfunction, this is this really broad umbrella term, right? It covers low desire, difficulty reaching orgasm, painful intercourse. That affects an estimated 43% of women.
Yeah, 43%. That's a massive number.
It's almost half the population.
Yeah.
Yet for decades, it's just been shrouded in this heavy silence. Or, casually dismissed by medical professionals as just a normal, unavoidable part of aging.
Which is just devastating when you think about the psychological toll that takes.
Oh, for sure.
I mean, your quality of life takes a massive hit when bodily autonomy and sexual pleasure decline, and for a very long time, the standard options offered to women were incredibly bleak.
Right. Like, what do they even offer?
You'd get a prescription for a hormonal cream, maybe, or a recommendation for an over-the-counter lubricant. Or worse, just a sympathetic shrug from a doctor who didn't really have any tools in their arsenal to actually help you.
So frustrating. But today, we're doing a deep dive into a procedure that completely upends that entire narrative. It's called the O-Shot, or the orgasm shot.
Barricade shot, yep.
And the central mission we're exploring for you today is whether or not this treatment actually delivers on its boldest claim. Like, can the O-Shot genuinely make orgasms stronger?
It's really easy to write this off as like a Beverly Hills wellness fad. You know the kind of thing, right?
Yeah.
Advertised with pink robes and champagne in the waiting room.
Totally. The super glossy Instagram ads.
Exactly. But if you look past those glossy clinic brochures promising, quote-unquote mind-blowing results, there is actually an emerging foundation of hard empirical science here.
Okay, color me intrigued.
Yeah, the clinical data is catching up. We've got a really comprehensive 2023 review from the journal Biomedicines and a brand new 2025 systematic review that aggregates the latest clinical trials.
Okay, so let's start with the actual blueprint of the procedure.
Yeah.
Because before we can judge if it makes orgasms stronger, we need to understand the biological mechanism at play. What is the actual physical process of the O-Shot?
So at its core, the O-Shot is built on platelet-rich plasma therapy, or PRP, as it's commonly known.
PRP.
Which is actually a massive staple in regenerative medicine.
Yeah.
The whole philosophy behind PRP is harnessing your body's own internal repair mechanisms, concentrating them into this highly potent serum, and then deploying them to a specific area of the body.
Okay, so walk us through the actual appointment. You sit in the chair. What happens first?
Well, the medical provider draws a small amount of your blood, usually right from your arm, just like a routine metabolic panel or, a standard blood test.
That's crazy.
Right. Then that vial of blood is placed into a specialized FDA-approved centrifuge. And this machine spins the blood at an incredibly high RPM.
Just whipping it around.
Exactly. The centrifugal force separates the blood into its distinct components. So the heavy red blood cells, they sink to the absolute bottom of the vial.
Okay.
And that leaves this sort of translucent golden liquid floating at the top.
And that golden liquid, that's the plasma.
Yes. And because of that intense spinning process, that plasma is essentially supercharged. We're talking about a serum that has anywhere from 1.6 to 6 times more platelets than you would normally find circulating in your bloodstream.
Wow. So it's like a payload of growth factors.
That's exactly what it is. Platelets are basically the body's biological flare gun. Like when you sustain an injury, say you cut your finger platelets, are the first responders that rush to the site.
Right, to clot the blood.
They aggregate to stop the bleeding, yeah. But more importantly, they release this massive cascade of growth factors that signal the surrounding tissue to start rebuilding.
Okay, so they're sounding the alarm for tissue repair.
Exactly. So with the O-Shot, a doctor extracts this highly concentrated liquid gold into a syringe and injects it directly into specific anatomical targets.
And looking at our sources, the clinical trials specify 2 primary injection sites, right? the clitoris and what is anatomically referred to as the distal anterior vaginal wall,
Right.
which, for the layperson, that's the area most commonly associated with the G-spot.
Yeah.
So why are we targeting those two specific areas?
It really all comes down to neurovascular density. Those two specific areas harbor the highest concentration of sensory nerve endings and blood vessels in the entire vaginal region.
Oh.
So if your goal is to stimulate a regenerative response that, profoundly affects sexual function and climax, you have to target the anatomical command centers for arousal.
Okay, so I have to say, this sounds identical to the vampire facial.
Oh, yeah, completely.
Like, that's been everywhere in dermatology for the last decade, where they microneedle your own spun blood into your face to stimulate collagen and make your skin look all plump and youthful.
It's the exact same core concept.
Right, but we were talking about applying a cosmetic principle to the vagina. So here's my friction point. I completely understand how boosting collagen makes a cheekbone look plumper.
Sure.
But how does injecting plasma translate to a stronger, more intense orgasm? Like, what is the biological bridge connecting a skin treatment to a physiological climax?
That is the crucial question. Because you're right, we aren't just trying to make tissue look younger. We actually need it to function at a higher capacity.
Right, it has to actually do something.
Exactly. So when you inject that concentrated serum of growth factors into the clitoris and the vaginal wall, the platelets fire off that biological flare gun we just talked about. And the first thing they do is stimulate pluripotent stem cells in the local tissue.
Wait, pluripotent stem cells, those are the blank slate cells, right? The ones that can basically develop into whatever specific type of tissue the local environment demands.
You nailed it. They are the foundational building blocks. So the growth factors essentially wake up these dormant stem cells and signal an urgent need for fresh, functional tissue.
Okay, that makes sense.
And this triggers a massive biological cascade. The most important phase of this cascade is called neovascularization.
Eovascularization.
Yeah.
Meaning new blood vessels.
Exactly. The PRP literally commands the body to build brand new healthy blood vessels throughout the injected area. Alongside that, it promotes intense collagen synthesis, which restores the elasticity and thickness of the vaginal wall.
Okay, so plumper, thicker tissue.
Right. But the real key to your question about orgasms is nerve regeneration.
Wait, really? It's actually repairing or growing new sensory nerve endings.
The growth factors actively facilitate the repair of damaged nerves and the proliferation of brand new sensory nerve fibers.
Oh, wow.
Think about the physiological mechanics of a powerful orgasm. You need two main things. First, you need intense vascular engorgement,
Right.
which requires a really robust, healthy network of blood vessels to rapidly deliver blood to the area. Second, you need hypersensitivity, which requires a dense, healthy network of nerve endings to transmit that pleasurable friction to the brain.
Oh, I see. So by triggering new blood vessels and actually regenerating the nerves, the O-Shot is quite literally building the physiological infrastructure required to support a stronger climax.
Yes.
It's basically upgrading the plumbing and the electrical wiring at the exact same time.
That's a great analogy, which is exactly why the biological theory is so sound. You are flooding a very specific, highly vascular pelvic region with the exact raw materials it needs to optimize itself.
Wow.
Healthier tissue, massively increased blood flow, and heightened neurological sensitivity. Those things directly correlate to a more powerful climax.
So biologically, the infrastructure makes complete sense.
Right.
I get that. But building a better vascular network in a petri dish or, in a textbook theory, that doesn't always justify spending $2,000 at a boutique clinic in reality.
No, it certainly doesn't.
So do these biological changes actually translate to the bedroom? Let's talk about what the clinics are promising versus what the rigorous clinical trials actually prove.
Yeah, and it is so important to maintain a healthy skepticism here. Whenever traditional medicine leaves a massive gap in patient care, like the historical dismissal of female sexual dysfunction we talked about, commercial enterprises are very quick to step in
Oh, instantly.
and fill that void, usually armed with aggressive marketing and really hefty price tags.
Well, yeah, and the claims on these clinic websites, they are sweeping. Like, providers are advertising that the O-Shot treats everything from standard vaginal dryness and postpartum low libido to highly specific medical conditions like lichen sclerosis.
Right, which is a severe chronic inflammatory skin condition.
Exactly. Some even claim it cures stress urinary incontinence. And because this is an elective, entirely out-of-pocket procedure, a patient is looking at spending anywhere from 1,200 to 1,600 pounds in the UK. or roughly $1,000 to $2,000 in the U.S.
It's a huge investment, which means the burden of proof is incredibly high. We have to look past the marketing language and examine the hard science.
Right.
And this is where that 2025 systematic review becomes an invaluable tool. The researchers basically aggregated multiple clinical studies to see if the real-world application matched the biological theory.
Okay, so let's get into the actual trials.
Yeah.
Because I'm always curious, how did they measure something as subjective as sexual pleasure?
It's tricky, right? But in the study specifically isolating female sexual dysfunction, researchers tracked 172 women across 5 distinct clinical trials.
Yeah.
And importantly, they didn't just ask these women a vague, like, do you feel better sort of questionnaire. They utilized validated clinical instruments, most notably the Female Sexual Function Index, or the FSFI.
Ah, the FSFI. That's essentially the gold standard metric that researchers use to quantify sexual function, right? It breaks a very subjective experience into measurable data points.
Exactly. It breaks sexual function down into 6 specific, highly detailed domains: desire, arousal, lubrication, orgasm, satisfaction, and pain.
Very comprehensive.
Evaluating a patient across all these domains gives a really holistic picture of their sexual health. And the results of these trials were genuinely compelling. Across the board, researchers recorded statistically significant improvements.
Okay, so walk us through what those improvements actually looked like for the women in the trials, like on a practical level.
Well, women experienced a measurable increase in spontaneous sexual desire. They had better natural lubrication, which significantly reduced any friction-related discomfort. Their baseline arousal was higher.
Okay.
But crucially, and this ties back to the exact focus of our deep dive, there were statistically significant documented improvements in both the frequency and the overall strength of their orgasms.
So it actually works. There was also a fascinating secondary finding in the sources regarding psychological distress, wasn't there?
Yes, there was.
Like women reported feeling significantly less anxiety, less guilt, and less frustration regarding their sexual health, which, I mean, is completely logical.
Oh, absolutely.
If your body is finally responding the way you want it to, and the physical roadblocks to pleasure are gone, that heavy mental burden just sort of evaporates.
The mind-body connection in sexual health just cannot be overstated. Restoring the physical function naturally alleviates all that psychological pressure.
Okay, wait, but if this is such a biological slam dunk, and we have 172 women showing statistically significant, documented improvements across all these domains, I have to bring up a glaring contradiction.
Uh-oh. Let's hear it.
If you look up platelet-rich plasma on Wikipedia right now, the entry explicitly states that for the O-Shot, quote, no evidence supports such claims.
Ah, yes.
That is a pretty damning contradiction for an audience trying to figure out if this is real, right?
It's a massive contradiction, and it perfectly highlights the tension between early clinical promise and established conservative medical consensus.
Okay, so what's the deal?
It comes down to a very specific and frankly somewhat frustrating concept in medical research called clinical heterogeneity.
Clinical heterogeneity. Okay, let's dig into that because it sounds like the key to why my primary care doctor isn't offering this yet. What does that actually mean in the context of booking an O-Shot?
Well, it means that right now there is no standardized, universally agreed upon medical protocol for how to administer this treatment.
Meaning everyone does it differently.
Exactly. It is the equivalent of baking a cake without a standardized recipe. If you go to a high-end clinic in London, the doctor might draw your blood, extract 2 milliliters of PRP, and inject it in a single session.
Right.
But if you fly to Los Angeles, a totally different doctor might extract 10 milliliters of PRP, use a different brand of centrifuge, and insist you come back for 3 consecutive monthly sessions.
Oh, wow. So because the preparation methods, the equipment, the injection volumes, the session frequencies, because all of that keeps changing from study to study and clinic to clinic, the broader medical establishment just throws its hands up.
Exactly. They can't point to a single replicated protocol and say, yes, this exact dosage yields this exact result.
And predictable outcomes are basically the bedrock of modern medical ethics.
You have to be able to tell a patient exactly what to expect from a specific dose. Add to that the fact that these clinical trials, while very promising, still have relatively small sample sizes.
Right, 172 women.
It's a great starting point for a very specific dysfunction, but it's not the multi-center, double-blind trials with thousands of participants that you typically see for, say, FDA-approved interventions.
So because of the inconsistent recipes and the smaller sample sizes, the broader medical community and encyclopedias like Wikipedia that reflect strict, established consensus, they still categorize the O-Shot as investigational.
Correct.
It is not an officially approved clinical guideline. It's not that the science is fake. It's that the scientific community needs everyone to perform the exact same experiment thousands of times before they officially stamp it.
That is the perfect way to frame it. The biology is sound, the early data is highly positive, but the standardization is lagging way behind the commercial rollout.
Which raises a massive, highly practical question for you, the listener. If the medical community still views the protocol as unstandardized and investigational, is this procedure actually safe to undergo right now?
And that should always be the first question.
Right. If you decide the potential for stronger orgasms is worth $2,000 and you book an appointment tomorrow, what are the genuine physical risks?
And here is where the O-Shot has an overwhelming advantage over, pharmaceutical drugs, synthetic hormones, or artificial fillers. The safety profile is incredibly high.
Because it's your own blood.
Exactly. Because the procedure uses autologous material, meaning the serum is derived entirely from your own body. The risk of an allergic reaction or tissue rejection is practically non-existent.
You literally cannot be allergic to your own blood.
Right. When researchers in the 2025 systematic review combined the safety data across 12 different O-Shot studies encompassing 317 women, the safety metrics were striking.
What did they find?
Out of those 317 women, only 3 experienced any side effects whatsoever.
Wait, 3 women out of 317? That's less than a 1% complication rate.
It's remarkably low.
But, the specific nature of those side effects in the sources is wild.
Yeah.
Of those 3 women, 2 were in the sexual dysfunction cohort, and their documented quote-unquote adverse reaction was that they experienced continuous arousal and spontaneous orgasms following the injection.
Yeah. It is certainly one of the most unique adverse event reports in clinical literature.
I can imagine.
For those 2 women, it was medically categorized as an adverse event because it was unprompted, persistent, and highly distracting to their daily lives.
Well, sure.
However, it is worth noting that it resolved completely on its own without requiring any medical intervention.
Still, if we are evaluating whether this shot can truly impact orgasms, having spontaneous orgasms listed as your primary clinical side effect absolutely underscores how powerfully the nerve endings in the clitoris and vaginal wall react to a sudden flood of concentrated growth factors.
Well, it undeniably proves that the mechanism of action, that intense nerve regeneration and the subsequent hypersensitivity, is physically occurring in the tissue. In those 2 cases, perhaps a little too aggressively in the short term. But looking at the aggregate data, the safety profile strongly suggests the risks are minimal. The vast majority of women report nothing more than minor swelling or, slight tenderness at the injection sites for a day or 2.
Okay, so let's map out the timeline. If you are sitting in the clinic chair, what does the actual experience feel like, and how long until you actually see results?
So the physical procedure is very straightforward. The provider applies a strong medical-grade topical numbing cream to the injection sites.
Crucial step.
Absolutely. Because of this, the actual injections, which are administered using an incredibly fine needle, they're generally described as nearly painless, or at most, a slight pinch.
Okay, that's reassuring.
The entire appointment, including the blood draw, the centrifuge spin, and the injections, takes about 30 to 45 minutes. You can walk out of the clinic, go back to work, or even resume sexual activity that same evening. Though many doctors do advise waiting 24 hours just to allow any minor swelling to subside naturally.
But to be clear, you don't walk out of the clinic with an instantly revitalized sex life. The biology takes time to do the heavy lifting. Right.
Correct. You are injecting the biological flare gun, but the body still has to actually build the infrastructure.
Right.
The platelets release the growth factors immediately, but those factors take about 2 to 3 weeks to really engage the stem cells and start forming those new vascular networks and collagen fibers.
Because neovascularization is a complex process.
Exactly. Most women report noticing a tangible difference in their baseline sensitivity and natural lubrication right around that 3-week mark.
And when do the results hit their peak?
The maximum benefits, like the absolute peak of the tissue regeneration and nerve sensitivity, usually manifest around 3 to 4 months post-procedure.
Which brings us to the catch. How long does that newly built vascular and neurological infrastructure actually last? Because the glossy clinic brochures confidently claim that the effects of the O-Shot will last anywhere from 1 to 2 full years.
Yeah, they do.
Does the hard empirical science actually back up that 2-year timeline?
This is where we run into a very significant blind spot in the current scientific literature.
Uh-oh.
While the clinics are more than happy to advertise 1 to 2 years of efficacy, to justify the high price point, the 2025 systematic review explicitly points out that current clinical studies have only tracked patients for up to 12 months post-treatment.
Wait, so we literally have 0 clinical data past year 1?
Exactly. At the 12-month mark, the women in the clinical trials were still showing statistically significant improvements in arousal and orgasm strength compared to their baseline.
That's good.
It is. But definitive long-term tracking data like what happens at month 18 or year 3, it simply does not exist in the peer-reviewed literature yet.
Wow.
We don't know if the newly formed blood vessels eventually degrade, requiring a maintenance shot, or if the regenerative effects permanently plateau at a new, higher baseline.
We just don't know yet.
That is the inherent nature of engaging with an investigational treatment. The long-term horizon is literally still being mapped out by researchers as we speak.
Okay, well, we've navigated a lot of complex territory today, moving from cutting-edge regenerative biology to the realities of commercial aesthetic clinics. So where does this leave you?
Right, the bottom line.
The central takeaway is that the O-Shot is definitely not marketing snake oil. It relies on established, peer-reviewed regenerative biology. By flooding the clitoris and the anterior vaginal wall with your body's own concentrated platelets, it triggers real, measurable physiological changes.
The creation of new blood vessels, thicker tissue, and highly sensitized regenerated nerve endings.
Exactly, and the clinical data firmly supports that biological theory. We have statistically significant evidence proving that this procedure shows profound clinical promise for increasing desire, improving natural lubrication, and crucially, improving the frequency, ease, and absolute strength of a woman's orgasm.
But, you have to weigh that against the clinical reality. The O-Shot remains a very expensive, entirely out-of-pocket elective treatment. Because the medical community hasn't agreed on a standardized protocol for dosage or frequency yet, it is still classified as investigational.
Right. If you pursue it, you are basically stepping onto the bleeding edge of regenerative medicine, operating ahead of official, standardized medical guidelines.
But if we pull back and look at the larger cultural shift, the very existence and rising popularity of the O-Shot represents something profound.
I completely agree.
For decades, female sexual dysfunction has been incredibly common, affecting nearly half the population. Yet it has been vastly under-researched and clinically ignored.
Yeah, women were expected to simply tolerate painful changes in their bodies, offered little more than silence.
Exactly. So the O-Shot, regardless of its current investigational status, represents a vital, aggressive movement toward taking female sexual pleasure and intimate health seriously in a clinical setting. It is a medical acknowledgement that sexual well-being is a fundamental, non-negotiable part of overall human health.
It radically shifts the conversation from just learn to live with it to let's actively regenerate it.
Exactly.
Which brings me to a final, lingering thought for you to mull over as we wrap up. We started by discussing the blueprint of the human body.
Yeah.
If our own blood, just a few vials spun down in a machine, contains the precise biological blueprint needed to completely regenerate our sexual function, build new nerves, and drastically enhance physical pleasure, what else are we capable of?
It's a huge question.
What other physical conditions, what other accepted signs of aging or quote-unquote taboo dysfunctions in our bodies might we soon be able to completely reverse? Simply by learning how to properly redirect our body's own internal healing mechanisms.
It really is an incredible frontier. The pharmacy of the future might not be a pill bottle at all. It might just be flowing through our veins right now, waiting to be utilized.
Just a wild thought.
Well,
keep exploring, keep questioning the consensus, and we'll see you on the next deep dive.